Hi, we have already learnt about what are the causes, what are the symptoms, how the piles, fissures and fistulas present. Let us know now what is the best treatment for all this and what advanced techniques are there for the management of these kind of diseases. And each one has separate kind of treatment when it comes to management of piles, fissures and fistulas. Let us take one by one. The first thing is piles, how to manage. Olden days we always used to operate in the open technique. We call it a St. Mark's open technique, where we used to cut all the 3 piles and the wound used to heal over 3 to 4 weeks, and it was painful, but the results were excellent. And experts only has to do these kind of surgeries, otherwise they may land up with either anal stenosis, that is narrowing of anal canal, or loose anal canal with incontinence. That means you won't have control over your stools. So let us see what best advances are there for piles management. Piles, we always divide them into grade 1 to grade 4. When I do a proctoscope, that means on the bedside when I put a small instrument and see proctoscope, the grade 1 piles will disappear as soon as I put the scope. Grade 2, they will come into the scope. Grade 3, they will be visible when I start putting the scope. They are visible to me as soon as I just enter there. Grade 4 is visible outside. You can feel them when you are cleaning up after washroom. So grade 1 and grade 2, technologically we have so advanced, we use lasers. We use lasers to treat in a technical way, methodological way, because laser, when we use laser, we should have a focused treatment on particular pile mass. So grade 1 and grade 2 we can burn them using laser. It's a permanent cure. Grade 3 and 4 we cannot use lasers. We have to use the new technology called stapler hemorrhoidectomy, where we always use this gun, one time use, we have to use and throw. It was quite costly. It is coming down because of different companies are coming up. And in this, what we do is, for example, this is the anal canal. Once I pass like this, I take stitches around this and put this piles mass into a circumferential stitch. We call it as purse string stitch. And once I do that, once you tighten it, you will get all your pile mass into this. And once I completely close, I fire like this. Once I fire, this will cut the piles mass, and the staples are around here. They join the remaining intestine end to end. The advantage of this is bloodless. You will not have bleeding. Very few people can have bleed. We can stitch there only, and it is painless. I would say rather painless, less painful, and which will be there for a day or two, because once I put this gun into anal canal, it will dilate. This is 4 centimeter size. It will dilate. That dilated pain you will always have. That will be there for a day or two. And these are called office surgeries. You walk in, get your stapler done, and go home by evening, and get back to your work probably on the next day. So the technology is so advanced, and we are refining them further so that we can do a little more easier with whatever the little pain you have. We should make it zero. So we are finding much smaller ones are most pliable, what we call it as soft, so that when I insert you should not feel that you have pain. So the best thing is, the best part nowadays is these are all very easily performable surgeries in expert hands and with very good results. And this is the treatment, advanced treatment for piles. When it comes to fissures, in olden days there was only one technique called sphincterotomy or dilatation, manual anal dilatation. But nowadays people always come and ask me, sir, there is laser, I believe, can we do fissures with laser? Yes, we use laser to cut the sphincter, but I don't advise personally, because You already have a wound. If I use the laser to treat that, it can increase the wound, the burning or with tissue damage. I would use a small 11 number blade and cut your sphincter at the edge with a nick and cut it off and make it relaxed. The aim of this is usually done for chronic fissures. Acute fissures are managed medically. We'll give them medicines, advise them to have high fiber food, avoid constipation, eat time to time and more liquids, more fiber, depend on nature. So that can be treated medically, and in some patients we use botulinum injection. It is a toxin derived from Clostridium botulinum, the organisms, and we inject that into the muscle, what is called that sphincter, internal sphincter, that will become weak. We call it, we paralyze that. So once that is, it is almost same as sphincterotomy. We dilate it and leave it and inject and leave it. But chronic fissures, usually the response with botulinum is very less. So we always prefer to do sphincterotomy. Sphincterotomy, as I told, it's a little bit painful. It will be there for a week to 10 days. After that, you are completely cured. Coming to the most complicated disease in the perineal area, the fistula. It is very difficult to convince anybody that everybody wants 100% cure. The fistula is one where the person whom I tell you will have 100% cure may have recurrence, whom I say 80% recurrence may get cured. That means there is uncertainty in the recurrence of fistulas. It all depends on, one is how good the surgery is being done, and it all depends on how many tracts are there, and have you seen all the tracts during surgery and blocked them, then only results will be good. This can be noted if the tracts are multiple. If the outside tract is one, we will always think that there is only one tract, but there will be branches. We have to cut all those branches or ligate those branches. Unless you do that, there won't be cure for fistula. For that, we always decide to get MRI anal canal or MRI fistulogram, which gives all the branches, so that if they are high, the treatment is different. If they are low, there is a new technique called lift. In the olden days, every patient, almost out of 100 people, 80 people used to get recurrence. With this new technique, almost 70 to 80% people are getting cured. So that means there is an inverse response compared to olden days, where we we trace the tract completely at the inside opening and ligate it off, separate it from the anal canal, and the rest of the tract is lay open or taken out, and get the dressings done ethically, neatly by the treating surgeon or the team, and till you are getting cured. So if you do that, most of the people, at least in my experience, have a cure. So the treatment for fistula nowadays is new technique called lift, which very few people do perform, only if you know the sphincter anatomy, because hardly any millimeter gap between the external and internal sphincter. In between that we have to go. So if you have a technically good knowledge about the anatomy of the anal canal, you can successfully deliver the goods. See, this is the three different varieties of diseases and three different kinds of advanced treatments for piles, fissures and fistulas.